Dear brothers and sisters, warm greetings from Sri Balaji Vidyapith, popularly referred to as SBV. I am delighted to meet you all once again through Channel 1. I thank you for your continuous support in this endeavor. Today, we are going to address a very important topic essential for delivery of universal health care, that is patient safety. Patient safety represents an important dimension of quality care alongside accessibility, acceptability, effectiveness, efficiency, and patient-centered approach. Indeed, patient safety is one essential facet for promulgating effective universal health coverage under Sustainable Development Goal 3. That means ensuring healthy lives and promoting well-being for all at all ages. Some of the major concerns regarding patient safety include medication errors, healthcare associated infections, unsafe surgical care procedures, unsafe injection practices, diagnostic errors, unsafe and suboptimal biomedical waste management, and lack of a safe hospital environment, among others. Having said that, I need to emphasize that recognizing patient safety is a global health priority. The World Health Assembly adopted a resolution on patient safety which unanimously endorsed the establishment of World Patient Safety Day to be observed annually on 17th September. The 72nd World Health Assembly in 2019 adopted an action plan, the purpose of which was to provide strategic direction for all stakeholders for eliminating avoidable harm in healthcare and improving patient safety in different practice domains. The action plan provides a framework for countries to develop their respective national action plans on patient safety, as well to align with existing strategic instruments for enhancing patient safety in all clinical and health-related programs. The Government of India drafted a National Patient Safety Framework in 2018 that essentially brings together diverse programs for implementation in order to give impetus to patient safety elements. Its main guiding principles are investing more in strengthening health system across its core, ensuring health services which deliver effective, safe, quality personnel and non-personal health interventions, fostering well-performing health workforce, equitable access to essential medical products, vaccines and technologies of assured quality, safety, efficacy and cost effectiveness, and their scientifically sound and cost-effective use would continue to be our mainstay. It also includes strengthening leadership and governance, besides continuously endeavoring to ensure all levels of care.
Greetings from Sri Balaji Vidyapith. I am Dr. Swati Pawar, Deputy Medical Superintendent, Mahatma Gandhi Medical College and Research Institute Hospital. Safety issue of patients has to be addressed for advancing safe, high quality clinical care for all patients, rich and poor, now and in the future. Dr. Berwick, a pioneer in patient safety research movement, had these pearls of insights to share after spending a lifetime in studying patient safety. The problem is not errors but harm. The focus should be on how can we keep patients from being hurt and less on how can we keep errors from happening. We used to believe that rules create safety. The truth is more nuanced and involves both making the rules and knowing how and when to break them in order to create safety. Reporting is valuable to track problems and progress, but to learn from errors, instead of asking how many, we should ask what happened. Every technology has hazards. Building technology for safety is crucial, but it must be supported by conversation, which is a human mechanism for getting control back. Healthcare differs a lot from other high hazard industries. The simple minded adoption of safety practices from other industries will not work. We need to adapt these solutions to the unique problems healthcare throws up. Hence, patient safety is a complex, multifaceted objective that demands a multi-pronged approach. SBV will always be a benchmark for taking such quality and patient safety initiatives, and I am glad to inform you that MGMCRI Hospital is the first organization in the Pondicherry Union Territory to receive NABH certification, NABH Nursing Excellence certification, and the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana Gold Standard Quality Certification, and many more. Few of the highlights of our organizational best practices at MGMCRI include patient safety initiatives, including implementing the international patient safety goals, hospital emergency codes, conducting regular mock drills, incident reporting system, and a hospital-wide safety program, that is patient safety and quality assurance program, the laboratory safety program, radiology safety program, hospital infection control program, fire and non-fire emergency program, medication safety program, and occupational health hazards, etc. We regularly conduct induction training program for the newly joined staffs, in-service education for our employees, hands-on training program like the basic life support and advanced care life support, and other workshops like CMEs, CNEs, etc. for all healthcare workers. Emergency codes allow trained hospital personnel to respond quickly and appropriately to various events. The use of codes can also help prevent concern or panic by visitors and people being treated at the hospital. We have code blue for cardiac emergencies, code pink for missing babies, code red for fire, code yellow for mass casualties, etc. Regarding the prevention of hospital associated infection, our Hospital Infection Control Committee and team plays a major role in the prevention of infection among patients. We conduct a number of awareness programs for the public, patients and visitors in MGMCRI and conduct regular camps in both rural and urban areas. The patient and family education are given at appropriate time, example at the time of discharge or at the time of rehabilitating the patients. We also implemented the international and national patient safety practices. The good reference is NABH standard guidelines and the OSHA guidelines. The focus has been on preventing harm, which means that what's important is what happens before the injury, and the reality is that what happens after the injury is also important. Part of our safety culture has got to focus on the healing side, and we have to heal both the injured as well as the person who caused the injury. People are a part of the reason why errors occur, because they hold the key to the solution as well, because all medical care is provided by people.
On many occasions, it so happens that processes of patient identification and surgical site marking may be found deficient. Medication error happens not because of inattentive healthcare personnel, but because of complicated and ill-defined, multi-step system of medication management, right from the act of prescribing to dispensing and administration. Yet another point that acquires relevance is the fact that patient safety discipline is a function of good teams, not good individuals acting alone. The discipline of patient safety rejects the notion of I in favor of we. This is because of the fact that the technological sophistication of the last century has introduced unprecedented complexity and fragmentations in healthcare. Hospitals can be chaotic because of frequent interruptions, emergencies, shift changes, and this leads to the discontinuity in care. The solitary possible way to deliver safe and efficient care in such a complex, fragmented system is to bring together professionals and motivate them to work as a coordinated team. Another model that is available to us is that of just culture. A just culture model provides a framework of shared accountability. The model proposes that since the human condition cannot be changed, the only hope for safer care lies in a relentless focus on improving systems of care.
Greetings from SBV. The year-long celebration of Azadi Ka Amrit Mahotsav culminated in the grand celebration of the 76th Independence Day of our mother nation, which was observed on the 15th of August 2022 amidst great patriotic zeal and fervor. Professor S.C. Pareja, our Honorable Vice Chancellor, hoisted the national tricolour and accepted the Guard of Honour. Various competitions and events were held in commemoration of Azadi Ka Amrit Mahotsav, which intense glorious competition, quite intense too, from the students of the constituent teaching units of SBB. These events were held in compliance with the directives of the University Grants Commission. Cash awards and certificates were given away to the winners. Cash awards were also given away to wards of the employees belonging to the non-teaching staff for having shown exemplary academic performance at the school level. Sri Balaji Vidyapeeth, fondly referred to as SBV, has been at the forefront in creating educational leaders in health professions education. SBB figures in the select band of interprofessional institutes in health professions education and lays particular emphasis on unique models based on pedagogic learning. In existence since the year 2013 as SBB AHEAD, which stands for Sri Balaji Vidyapeeth Academy for Health Professions Education and Development, it initially focused on faculty development in pedagogy. Now it has been transformed into the Center for Health Professions Education with reference to the year 2015. Finally, it has metamorphosed into an Institute of Health Professions Education, which is indeed a path-breaking reform. It will be the first of its kind in any higher education institution focusing on health professions education. This unique institute, namely Institute of Health Professions Education, abbreviated as IHPE, was inaugurated by Professor P.B. Vijayaraghavan, the Honorable Vice Chancellor of Sri Ramachandran Institute of Higher Education Research, Porur, Chennai, on September 5th, coinciding with the Teachers' Day. The Honorable Chancellor of SBB, Sri M.K. Rajgopalan, Honorable Vice Chancellor of SBB, Professor S.C. Pareja, Dean of Faculty, Professor N. Ananthakrishnan, Professor Ravi Kumar Chitoria, Registrar JIPMER, and several other luminaries participated in the colorful event, which is indeed an epoch-making event.
We have to recognize that patient safety is fundamental to the provision of health care in all settings. However, avoidable adverse events, errors, and risks associated with health care continue to pose major challenges for patient safety globally. It is time that mature health systems take into account the increasing complexity in healthcare settings that make humans more prone to committing errors. They should collect and utilize data effectively to improve patient safety. Reporting the incidents with even minor details allow the data to be measured and analyzed to avoid future mishaps. We should invest in continuous awareness and education of the staff and also update patient safety protocols appropriately in order to help implement more efficient procedures. With the appropriate steps, we will be able to look at patient safety across the entire continuum of care, not limited to the walls of the hospital, clinic, or care facility, but to encompass the full scope of patient lives and patient care experiences. I wish you the best of health. Do remember to continue practicing physical distancing, wearing masks, and personal hygiene. Stay safe. God bless you. Jai Hind.